Hi, my name is Jane Mata, and my final project is titled Multimodal RAG for Drug Safety and Risk Assessment. The problem that I focused on is drug safety and evidence and information overload, specifically for clinicians. This is a pipeline. It's a system that is designed only for doctors, not for patients. Um, they have to deal with all this new information that comes constantly, and they have to check for interactions. And in general, LLM can give you a very nice answer, but it's sometimes not grounded in actual evidence and can hallucinate. So my project builds a clinician-facing RAG prototype for two types of questions: drug-drug interaction questions and drug condition type of questions. For example, you can ask, this drug and this drug, can we take them together? Or if I have this condition, can I take this medication? The pipeline extracts the drug and condition terms, then normalizes them with Rx-norm, Rx-nav, retrieves evidence from a drug bank style interaction table, and other types of sources like OpenFDA, DailyMed, and labeled texts, and also structural metadata from this pictures from PubChem of molecular structure, and this very small pharmacology, biochemistry support layer sort of dictionary that I created just to try this idea. The retrieval evidence is converted into a text-based chunks. Then I use this pre-trained sentence transformer. There's this thing called FASS that will help retrieve the most relevant using cosine similarity, the most relevant evidence for this particular question, and then the LLM generates the answer. A second LLM verifies and checks whether this is supported, if it's safe, contraindicated, too broad, etc. And if it's if it looks like a hallucination, it'll flag it, and I will register in an audit registry. So we go here to the an example of how this works. It's you ask a question. I use Gradio. You ask a question, and then the system will tell you, will give you the answer. It'll say, okay, this is coming from these sources, and it gives you the supporting evidence. And in this case, it logged it as something is not 100% with this answer. It's going to be logged as possibly a hallucination. There's another one here that I have. It's patient and the disease, and here it does the same thing, but it gives you the trace of where this information it's coming from. So generally, the limitations are a few. Basically, it's not clinically validated medical system. It needs more information corpus, more pharmacological information, but it can work, and it can make drug safety answers more transparent and reviewable and traceable, and effective for the clinician that is going to use it. So thank you very much for watching.